I'm Mayor Sandy Stimpson. This Wednesday afternoon. I'm speaking to you from my office. You know, today's been one of those days when it's been filled with what can we do to help protect some of the most vulnerable part of our population and those who are exposed to those with the COVID virus. Early this morning, we started doing background research to see things we could do to help Crown Healthcare. So mid-morning, I was able to talk to the owner, and I very simply explained to him, I said, is there anything that we can do to help you with your patients and those who are living with you? And the conversation soon evolved to they really did need some masks. Well, that didn't take very long. We decided that we would ship them 500 masks. Those have already been delivered. They're tremendously grateful for that because in that environment, you know, they're not allowing anybody but employees to come and go. Those situations aren't any different than our hospitals. They have nurses there, they have caretakers there, you know, janitors, maintenance people. And so our hearts need to go out to them and our prayers need to go out to them just as it has to all of our other healthcare workers. But Crown was tremendously grateful for our outreach. Also, we're going to be helping Linwood Nursing Home. They need some test kits so they can test and see which ones of their employees may have been active in the antibody test to see if they can return to work or if they can continue working. Bigger news is probably what we've been able to do with the overall test kits. You know, so many of our hospital workers have been exposed to the virus, and a lot of them, you know, may not have, they're asymptomatic, but they continue to work, but they have the virus, and the hospital has not had the test kits in place where they could test everybody. Well, today, the University Hospital has 1,200 test kits. We have delivered 1,000 test kits to the Infirmary Health System, and later this afternoon we'll deliver 1,000 test kits to the Providence Hospital. Those were all to be used on their employees to make sure what their health condition is as they continue to serve you. Spring Hill Memorial actually said they didn't need any kits. They had plenty on hand, so we didn't have to do anything to assist them. One of the conversations that we had yesterday had to do with Franklin Clinic. And so I had the opportunity to talk with Charles White, who's the owner, and just asked him if there was anything that we could do to help them. And he said, I need some masks. And so earlier today, we delivered some masks. I think it was 250 masks to him. That's the N95 mask. And my understanding is he was somewhat like a kid at Christmas. He was so excited to know that his employees no longer had to reuse some of the masks that they were using. You know, this is one of the things, when using our networks and our resources to help find the personal protective equipment or the test kits, a laboratory to read the test kits. You know, those are things that we are engaged in every day, not just in my office, but in other parts of the city government, again, trying to protect the citizens of Mobile. Just switching notes just for a moment, from time to time during the course of the day, I have an opportunity to reach out to individuals to just find out how they and their company have transitioned. I had the opportunity to talk with Jeb Shell at Hargrove, and he said that, you know, once they realized that they needed to transition from working in the office to working at home, I think somewhat upwards of maybe 2,000 employees within a week's period of time, they were all working smoothly from home. You know, had very few glitches to begin with, but now he said, you know, it's just like this is what we've always been doing, learning new lessons like we all are. But those are the kinds of encouraging things that I hear every day about things that people are doing to adapt to the situation where we are so that they can protect themselves, they can protect their employees, and protect fellow citizens of whom they may not even know. So that almost wraps it up today. I would say that if you think back over the last few weeks, though, there's been a lot of conversation about, you know, first it was the schools closing down, and then it was how do we do a stay-at-home? When do we do a stay-at-home order, a curfew, hospital workers? But there's been something going on that's really been under the radar, and that has to do with what's been going on in the Mobile County Public School System. So tomorrow, we'll be telling you a lot about what they've done to adapt to this situation, and I think you're going to be real excited and real proud of that. So thank everybody for what you're doing. Stay safe, stay at home. And I would also ask, though, that if are there any questions, I think George Talbot had some emailed in. So, George?
We do. We have, you addressed the nursing home, but it's from Tyler at Fox 10. What is the city doing to help there? I think you covered that.
Yes. I mean, we have, even though I just mentioned two of the nursing homes, we have reached out to other nursing homes, and we're on standby to do anything we can from a personal protective equipment, of anything we have, or the test kits, if they'll just reach out to us.
Okay, this is from Dana at WKRG, who asked about vaccine trials in the city. Are you aware of any ongoing vaccine trials or possibly starting in Mobile?
Yeah, I'm not aware that there are any vaccine trials in Mobile, but just because I'm not aware of it does not mean that that's not going on. So our hospitals could be engaged in that.
Several questions about the curfew. How many citations have been given out? What's kind of the message on the curfew?
So my understanding is that there are multiple stops during the course of the night, but we've only averaged about 3 citations per night. And as I think everyone knows, our law enforcement officers, they have the ability to make a judgment call on whether somebody is really egregiously violating the curfew or whether they have a reason. So if they have a good reason, we pretty much let them go. But if they don't have a good reason, they're being given a ticket.
Steve Alexander at Fox 10 is asking about business owners. Have you got any ideas from business owners about a plan to begin reopening businesses?
Yeah, the other day when I was talking with the Chamber of Commerce, 2 business owners, and told them that they each individually needed to think about how would they start their business back up, knowing everything they know about the environment we're trying to operate in. And so we've had a couple very specifically say the stepped procedure that they would go to sequence startup. But while I've had a couple of those conversations, our focus right now is still on the stay at home. It's on testing. It's on making sure our first responders and those in the healthcare field have the equipment that they need to be protected. And we're going to continue for that to be our focus, our primary focus, until we start seeing the test results start to decline in a manner that they should decline. Because I know there are a lot of people already thinking about how to start up, but we don't want to lose focus on the primary part of our mission right now, and that's to keep you safe.
Last one's from Quinn Hillier, is asking about the reserve fund. How much did we have in reserve in terms of the percentage of the total budget, and where are we with the...
So when it comes to the reserve fund, there's $60 million that could be available for reserve. And our projection was based on numbers that we thought would be changes to revenue. We could be losing $10 to $12 million per month in revenue. At this point in time, we have not really called into the reserve account just because we haven't needed to do that for cash flow reasons. And it's just yesterday we started getting numbers in from our retailers on what kind of month they have had. Obviously, there are going to be some zeros in there, but it appears that some of our building supply businesses have done well for the month of March. And so when we get yesterday's numbers are actually reporting for March. But anyway, so it's a little too early to predict, at what point in time do we really dip into the reserve fund, but it's there, and when we need to, we will dip into it. Yep. So thank everybody for what you're doing. Stay safe, stay at home.